there.
Hey, how you doing?
I'm doing all right. My name is Deondra. I'm a graduate nursing student from Alcorn, and I'll be taking care of you today. Is that okay?
That's fine.
All right, your name is?
Brittany Robinson.
Brittany Robinson. All right, nice to meet you. Okay, Brittany, so we're going to start off. I'm going to ask you a few questions here. So first off, just what brings you in today?
For physical for nursing school.
All right, nursing school, congratulations.
Thank you.
All right, so you're not having any issues or any type of symptoms or anything like that?
No, ma'am.
Okay. All right, so what about any past medical problems? Any history of any heart problems or lung problems?
No, ma'am.
Any issues with your stomach, anything like that?
No.
No high blood pressure, high cholesterol, anything like that? Okay. Are you on any medicines at home?
Not at the moment.
Okay, so no medicines, that's good. All right. What about your immunizations, your childhood immunizations, flu and pneumonia? Are you up to date on those?
Yes, ma'am.
Okay, good, because they're going to be asking about that when you apply for nursing school. So then we'll just look at your family history, and that's important because sometimes it helps us connect the dots. So do you know of any medical issues with, we'll start with your parents' parents, your mother's parents?
No, ma'am.
Okay, either grandma or granddad, no medical problems that you know of, no
No.
allergies that you know of. Okay, what about your dad's parents? Any stroke, high blood pressure, anything like that?
No, ma'am.
Okay, or any allergies that you know of? All right, so then we'll go on down. What about mom? Does mom have any medical problems?
Just thyroid.
Thyroid disease, okay. Any allergies that you know of?
No, ma'am.
All right, so what about dad? Dad have any medical issues?
No, ma'am.
No, girl, your family's doing good. You have any siblings?
I have one.
Okay, a sister or brother?
A sister.
All right, does she have any medical
No,
problems?
ma'am.
Okay, and do you have any children?
No, ma'am.
No children? Okay, so pretty good family history there with no medical issues there. So do you attend church regularly? Do you feel like you have a pretty good support system?
Yes, ma'am.
All right. Do you smoke or drink at all?
No, ma'am.
Any recreational drugs? Okay, nothing. What about exercise? Do you exercise regularly?
Yes, ma'am.
Do a little
running.
running, walking? All right, well, that's always good. So you get around pretty independent. You don't need, you're a little young for a cane or a walker, but we have to ask because you never know. So what about diet? Do you just eat regular food at home? Ever notice any trouble swallowing?
No, ma'am.
No issues there. Okay, what about sleep? Do you feel like you sleep okay? No waking up throughout the night, anything like that?
No, ma'am.
All right, so we got to get in your business a little bit. Are you sexually active?
Yes, ma'am.
Use protection. So no concern about any STDs or HIV or anything like that today. Good deal. All right. What about stress? Do you feel like you have an increased amount of stress?
No, ma'am.
Okay, but you have a pretty good support system, close with family? Okay. All right, so the next thing we're going to do is just what we call a review of systems. And so I'll just kind of go head to toe, and we'll just see if you have any of these issues before we start our physical assessment. So would you say you've had any recent weight loss or gain that was unintentional?
No, ma'am.
Or feeling extra tired, anything more than normal?
No, ma'am.
Okay. Any issues with your skin? Have you noticed any rashes or moles or anything that you hadn't noticed before? All right. Head-wise, any dizziness or headaches? Any blurred vision or anything like that? None of that. So any issues with your ears, any drainage or anything have you noticed? Okay. So what about nose? No drainage there.
No, ma'am.
Issues with throat? Any pain or lumps or anything you've noticed in your throat? Okay. So again, with the personal business, just have to ask your breast. Are we having any pain in the breast area? Notice any discharge or anything there?
No, ma'am.
All right. Any issues with breathing? Have you noticed you're having any excessive cough or coughing up any sputum or anything like that? No pain when you take deep breaths? All right, that's good. So we'll just look at the heart now. Have you noticed any type of irregular heartbeat?
No, ma'am.
Nothing feels funny there, no pain, no chest pain or anything. All right. Belly, have you been having any nausea or vomiting?
No, ma'am.
Any heartburn or any stomach issues, any constipation or diarrhea? Okay, so pretty regular there. All right. Urinary, are you having any what we call urinary frequency? Do you notice you're having to go more? Do you have any pain or burning when you go?
No, ma'am.
Okay, all right, so that's good. Any issues with, do you get your still monthly period? When would you say the last time you had it?
About 2 weeks ago.
Okay, about 2 weeks ago. And when was your last pap smear?
Last December.
All right, so you're up to date. Have you ever been pregnant, or do you have any children?
No, ma'am.
Okay, so we're all good there. Okay, have you noticed any leg pain or swelling or anything like that?
No, ma'am.
All right, and any muscle aches or stiffness or anything? You're a little young for arthritis, so well, that's good. Have you been feeling any anxiety or depression? Any history with that?
No, ma'am.
Okay. Hold on to that. You're getting ready for nursing school, so just hang tight there. Have you noticed any increased agitation or just change in your mood, like mood swings? Okay. Any bruising, abnormal bleeding? Have you noticed anything like that?
No, ma'am.
All right. Any issues with your thyroid or any excessive sweating? Have you noticed anything? All right. Well, sounds good. So that completes the question part of our assessment, so then we'll move on to your physical assessment, okay?
Okay.
All right, thank you, ma'am. All right, Ms. Robinson, so we're going to go ahead and start our exam. I'm just going to wash my hands here, put on some gloves. All right. So we're going to start here with our assessment. We're going to start at the mouth and the nose. So I'm just going to start by just examining or inspecting, as we say, your lips. So lips are pink and moist. I don't see any excessive dryness or cracking going on there. Okay, I'm going to get you to open your mouth for me. All right, just a little wider for me. All right, so teeth look good, intact. I don't see any prosthesis or any dental caries, so that's good. All right, and a little while, I'm just looking at your gums. Okay, gums look pink and moist. I don't see any bleeding or ulcers. All right, so tongue is pink and moist. I'm going to get you to hold your tongue up for me. Okay, and then down, we're just looking at your soft and hard palate, which appear to be intact. So everything looks good. All right, so then we're going to do just a little test here. I'm just really listening for your voice to see if I hear any like a nasal voice or hoarseness. So I'm just going to get you to say ah for me. You don't have to stick your tongue, just say ah.
Ah.
Do a little longer for me. Ah, there we go. All right, so I don't hear any nasal stuffiness or any hoarseness, so that's good. So then we're going to do just a little test that kind of just test your sensory. So I've soaked 2 Q-tips in we'll call a substance today, and we're just basically going to be testing your sensory to see if you can taste if it's sour, sweet, or bitter or salty. Okay, so for this test, I'm just going to have you just stick out your tongue. We'll do one side at a time, and I want you to tell me if you taste sour or if you taste something bitter or what you taste. Okay, all right, let me get you to stick your tongue out for me, and we'll do this side first. Okay, what do you taste there?
Is it sweet?
Something sweet, all right. Okay, then we're going to do just your other side here. Okay, what do you taste?
It's a little bitter.
A little bitter, all right, good deal. Okay, let me get these back in so we can get rid of those. All right, so the next we're going to do just a check for your gag reflex. If I can get it out there. So I'm going to just get you to just open wide, and we're going to check your gag reflex. I'm going to tilt your head back just a little bit. Okay, and there. All right, sorry about that. I know that's a little uncomfortable. So we're just going to sit that there. And then I'm going to have you drink a little water. And this is basically to just make sure you don't have any trouble swallowing, okay? So you just take a sip of that for me. Any pain or any trouble with that? All right, looks good. Okay, then again, I'm just going to have you stick your tongue out for me. Just stick it all the way out. So tongue is midline. I don't see any deviations there. Okay, so tongue looks good. Open wide again for me. All right, and say ah again.
Ah.
Okay, so the soft palate does rise and the uvula remains midline. All right. Okay, so then I'm just going to take a look at your nose here, okay? So So just inspecting the nose is symmetrical. You do have a piercing, so that's fine. Okay, so I'm going to check for patency. The way I'm going to do this, we're going to close one nostril at a time, and I'm just going to get you to blow, okay? So we'll start over here. I'm going to get you to blow. All right, good. And then, all right, good deal. Okay, so then I'm going to cover this up here, and I'm gonna let you smell something, and you can, if you can smell what it is, you can tell me, but the important thing is I want to make sure that you can smell. We're gonna do just like we did, one nostril at a time, okay? Alright, so we're gonna close. Okay, smell. Alright, what do you smell there?
The cinnamon.
Mm-hmm. Alright, then we're gonna close this side. Take a sniff. You smell it? Alright, good deal. Alright, so then we're just going to take a look here. I'll have to look in each nostril here one at a time. Just turning my light on here. So I'm going to tilt your head back a little bit. And with this test, we're just looking at the nasal mucosa and the nasal spectrum. So we don't see any abnormalities there. No swelling or anything like that. No inflammation. So that's good. Okay. So then we're going to have to do a little palpation. I'm just going to change my gloves here. And what that means is I'll just have to press down a little bit. So I'm going to wash my hands again, and we're just going to change our gloves, okay? So we're just going to put some gloves on here after we've washed our hands. And we're just going to palpate a little bit, which just means we're just going to kind of touch and press down a little bit, okay? So I have to start here at your lips. We're just palpating the lips. Let me know if you feel any tenderness or anything like that. Any tenderness or pain. Okay. I'll get you to open up here. Open mouth wide for me. Alright. Okay, looks good. Any tenderness there? Nothing on your gums. Okay. Alright. So then I'm just going to swap these one last time here. We'll just wash our hands. And I'm just going to do the same thing with your nose. I just want you to tell me if you feel any tenderness or any pain. So we'll do that. Get these old gloves on. They give us trouble sometimes. Or me. I don't know if everybody else. There we go. Today sometime. There we go. Alright. So we're just going to touch your nose and just let me know if you feel any tenderness or pain there, okay? Alright, then we're going to check your sinuses. So we're just going to, I'm going to press right up here. We're just going to check your frontal sinuses. Do you feel any pain or tenderness? Okay, then we're just going to come right down here and let me know if you feel any pain or tenderness there at the mastoid sinus.
No, ma'am.
Alright, good deal. So we're just going to do one last test, which is just a transillumination test. I'm just going to put this light up against your nose, and it kind of just helps us see things a little better, okay? Alright, so I'm going to get you to tilt your head here. Let's get that up again. And open your mouth wide for me. Okay? And then next side. Good, good, good. Okay? Translution is clear, so there's no issues there. Alright, so we're all done there. So next we're just going to take a look at your belly. So I'll help you get comfortable there, okay?
Okay.
Alright. Alright, Ms. Robinson. So next we're just going to do our assessment of the abdomen, okay? So I'm just going to wash my hands here. I'm going to put on some more gloves. Still doing okay? Good deal. So just going to have you draped here so we don't expose anything we're not needing right now. And I'm going to have to lift your shirt up a little bit. Is that okay? Alright, so we'll just lift up here. So first we're just going to be just inspecting so we don't see any lesions or masses or any striae or anything like that, so that's good. Our umbilicus is inverted and it is midline, so that's also good. Our shape is rounded. We don't see any pulsations, any abnormal pulsations there, so everything is good there. So next we're just going to take a listen here, okay? Our stomach is symmetrical, so I'm just going to take a listen at your bowel sounds, okay? Use my stethoscope. Hopefully it won't be too cold for you. We're just going to start right over here, okay? And we're just going to take the bell of the stethoscope here and we're just going to listen to our arteries. So we'll start right here at the aorta. Then we'll listen to our renal arteries here. And just our iliac arteries here. Alright, so next we're just going to do a test that we call the liver span test here. Now we'll have to mark on you a little bit. I'll try to make it a small mark, but we're just going to have to measure here, okay? So we're going to do our percuss and then we'll go right into our liver span test. So when I say percuss, let me know if you have any tenderness or uncomfortable feeling, but basically I'll be sitting my finger there and I'll be tapping my own finger, but if you feel any excessive tenderness or pressure, let me know, okay? So we're just going to start right over here. Okay, and we do hear that tympani over that gastric bubble. A little dullness over the liver area. Okay, so we have tympani throughout, and then we're just going to do our liver span test here. So I'm just going to come, it's kind of what we call the midline here. We're just going to come right below the umbilicus, and I'm going to do the same thing I just done. I'm going to move upward, and I have to make a little mark once we hear that change in sound. And then we'll come up and go down and we'll measure that, okay? Okay. So we're just percussing here. Okay, so we'll mark right here. Just a little pin mark. Alright, then we're going to go up here just a little bit and we'll work our way down, okay? Okay. Same thing, just percussing. Okay, so we hear that dullness there over the liver, and then we're just going to measure. Okay, so you're right at 6, so that is good. Okay, so the next thing we're going to do is we're going to just do a little palpating, which means I'm going to have to press down on your stomach. We'll start with light palpating and then we'll have to, you know, do a little deeper palpating. But if you feel any excessive pain or tenderness, just let me know, okay? Okay. So we're just going to start right over here in our left quadrant there. And this is just some light palpating. Just let me know if you feel any pain or tenderness. Feeling any pain or tenderness? Okay, so we're just going to go a little deeper with the palpating, okay? Any pain or tenderness there? Still doing okay? Mm-hmm. Good. Okay. All right, so next we're just going to palpate the liver. So what I'll do on my count, I'll have you take a deep breath. And we're going to just move upwards and see if we can palpate that liver, okay? All right, so on 3, 1, 2, 3. Okay, and release. All right, so not palpable, so that is good, okay? All right, we're also going to do a test that we call the CVA tenderness, which just kind of also helps us just check your kidneys for any, if you have any pain, you'll let us know. It could be an indication for infection, okay? So what I'm going to do, I'm just going to move this down here. And I'm going to have you just swing your legs just right over here for me, and I'll help you up there. There we go. There we go. Alright, so I want to move this pretty hair here, okay? Alright, and so I'm just going to lift your shirt up a little bit. And we're just going to come right up here to that 12th rib. Find that area between the 12th rib and your spine there. And I'm going to put my hand there, and I'm going to pound on my hand. But if you feel any extreme tenderness or pain, you let me know, okay? Okay. Alright. Feel okay? Mm-hmm. How about that? Alright, okay, so everything with your abdomen looks good. And for now, that concludes our assessment here. So, do you have any questions or anything for me?
No, ma'am.
Okay, Miss Robinson. Well, good luck in nursing school. If there's any way I can help you, let me know. And thank you for letting me take care of you, okay? You have a good day.
Thank you.
Thank you.